We can talk now to Fern Howard from the charity Crohn's and Colitis UK. Good morning to you. Thank you very much for talking to us. In terms of IBD and children, what are we discovering more about?
Good morning. So this study is really important in growing our understanding of just how many people in the UK are living with inflammatory bowel disease. Over recent years, we've found that there are more than 540,000 people across the country, and around 10,000 of those will be aged 10 to 19. So more studies, more research is vital to make sure that there are enough doctors, there are enough nurses and specialists to treat people with inflammatory bowel disease.
You know, how easy is it to diagnose it in a child? Because children get upset tummies, don't they? And children kind of have food intolerances and, you know, get bugs. How quickly can it be diagnosed? Or how long does a child have to suffer before it's diagnosed?
Unfortunately, we hear things like this all the time. I mean, common symptoms can include tummy pain, urgency to go to the loo, blood in the toilet, but also things like constipation, which are very common in children. So actually that could be a number of reasons that a child has constipation. So it can often take several visits to the doctor and a lot of persistence in order to get referred for the right tests.
You can understand, I suppose, and it's part of what this campaign is about, is stigma attached to a disease like this. What sort of advice do you give to people who've had the diagnosis, particularly in young people, about trying to cope, I suppose, and normalise things in the face of what is a very difficult condition?
Definitely. And I think the big message is that you're not alone. And at Crohn's and Colitis UK, we have a community, a social media community, we have a helpline, we have information and advice. So you can get the support you need, but you can also share your experiences. And there are many young people with similar experiences, as Imogen's story tells us. So there is a lot of strength from this amazing community of people, and getting information and support is also really crucial. So anyone who has any questions, please do visit the Crohn's and Colitis UK website to find out more. Yes,
and I suppose, Fern, in a way, we look at this study and we think there's been this sharp rise in people being diagnosed with it. At the same time, and you tell me, in terms of the services available and how people are treated, has that improved since, I don't know, over what period of time? How would you analyse that?
So there's huge variation across the UK, and a lot of the numbers of staffing are based on old estimates. So as we know, there are a lot more people than we previously thought. So services are really stretched, and like what is happening across the NHS, there are huge waiting lists. People are not getting access to treatment as quickly as they need. So it is vital that the government invests in the inflammatory bowel disease workforce, making sure there are enough doctors, enough nurses, enough specialists to diagnose people with inflammatory bowel disease early, to get them on a treatment plan, because otherwise the complications can be life-threatening. People are going to A&E, they're ending up having emergency surgery. So actually it's in the patient's interest and the government's interest to make sure that services are resourced.
It's interesting, isn't it, that this study does show that there could be environmental and lifestyle factors as well as it being genetic. Is there anything, if, you know, parents are concerned, that they can do to help whilst they're waiting for this treatment, whilst they're waiting for diagnosis?
So the best thing really is to make sure that you're getting reliable information. I think there are a lot of well-meaning people out there, family, friends, who can search on the internet and come up with miraculous cures of things you could eat or avoid, but that is just not the case. And that is why there needs to be a lot more research into the causes and triggers of inflammatory bowel disease, but also using resources on our website to make sure that you know exactly what is happening, and also seeking advice from your specialist team. So your inflammatory bowel disease team, you should have access to a dietitian, but as we know, this is not available everywhere. So just making sure that you are keeping on top of things, and that you are persistent, and that you make sure that you do have the support that you need in place.
Thank you so much for joining us. Fern Howard, Head of Policy and Campaigns at Crohn's and Colitis UK. Thanks very much for your time with us this morning.
Thank you.